The fluorescent lights hummed overhead like a swarm of insects caught in glass. Katie Morrison moved through Seattle General's ICU at 6:11 a.m., her scrubs still damp from the rain outside, the rubber soles of her shoes clicking against the tile in a rhythm she'd perfected over 3 years, soft enough not to disturb sleeping patients, deliberate enough to announce her presence to any doctor who might need her invisible competence without actually seeing her. The smell of antiseptic and stale coffee hung thick in the corridor. She kept her eyes down. She kept her hands busy. She kept her voice measured and deferential when anyone spoke to her at all. Just another nurse. That was the carefully constructed lie Katie had learned to live inside, the way you might live inside a safe house for a witness, careful not to rearrange the furniture or leave sign someone was actually here. She had a face that colleagues struggled to remember. 38 years old, brown hair always pulled back in the same practical bun, no jewelry except for the faded wedding band she never removed and the broken chain she kept hidden beneath her collar where no one could see it. The shrapnel in her spine, 3 pieces still embedded near L4, too close to the vertebrae to safely remove, pulled at her sometimes when she stood too long in one position, a dull ache like an old argument that never fully resolved. She passed Dr. Ashford's office on the way to the med station. Through the glass, she could see him reviewing something on his computer, his face arranged in the expression he wore most mornings, superior, calculating, the look of a man whose authority depended on being the smartest person in every room. He didn't look up as she passed. He never looked up. Katie Morrison wasn't the kind of nurse worth noticing. She was competent but unremarkable, present but forgettable, the type who caught medication errors in her head before they became disasters but never spoke up loudly enough for credit. The ICU census board showed 8 beds occupied. Trauma admission coming in from the ER, Sergeant Marcus Chen, 24 years old, blast injuries, classified injury site, ETA 6 minutes. Katie scanned the notation and her hands stopped moving. The clipboard fell. It clattered against the tile floor with a sound like a gunshot in the otherwise quiet corridor. She bent down to retrieve it, buying 3 seconds of oxygen, 3 seconds to arrange her face back into the empty expression she'd perfected. Bagram. The notation said Bagram. 20 years ago, Katie had been extracted from a collapsed compound in Kabul, not as a nurse, but as something else entirely, someone whose hands knew how to save lives in the dark, someone whose name had been whispered with a call sign instead of words. Reaper. Because she had come for them out of the smoke and pulled what she could from the rubble. A boy, 8 years old, buried under concrete blocks and the weight of a wall that had stood for 100 years before American ordnance made it irrelevant. She had worked on him with field supplies and nothing else, no hospital, no surgical team, no equipment except what she could carry. She had kept him breathing. She had kept him alive long enough for the Black Hawk to arrive. She had never seen him again after that. The med station's fluorescent white light seemed brighter now, or maybe that was just the way her pupils had dilated, the way adrenaline was moving through her blood like a second heartbeat. She set the clipboard down with deliberate care. No trembling. No visible reaction. Katie picked up the admission paperwork with the steady hands of someone who had held lives together before, hands that remembered patterns of bone and blood and survival even if the rest of her tried very hard to forget. Bed 4. That's where they'd put him. She reviewed his labs without fully reading them, moved through the motions of room preparation like she was underwater, the way you move in dreams where your limbs weigh more than they should. Ventilator settings. For pumps. The monitors they'd need, all arranged in their precise positions. Everything in its place. Everything controlled. The cold stainless steel of the bedside table gleamed under the harsh overhead lights. She could smell the ozone scent left behind by the cleaning crew, the sharp chemical underscore of bleach. The doors to the ICU opened at 6:53 a.m. They wheeled him in on a trauma stretcher, young, devastated, his body wrapped in compression bandages, his left arm ending just below the elbow. His face was intact. His eyes were intact. Those were the things Katie noticed first because her brain had been trained to catalog such things, to prioritize what could be saved. And then he turned his head. He couldn't hear the alarms. The ventilator's rhythmic whoosh. The monitor's steady beep. He was deaf, the admission notes had said, deaf since childhood, before his service, before the blast that took his arm. His eyes found hers across the room with the kind of intensity that suggested he saw more than just movement, more than just the shape of another person. His eyes locked onto her like recognition, like gravity. Katie's breath went shallow. She forced it deeper. She had trained for this, for staying composed when everything inside you was screaming, but she hadn't trained for this. She hadn't trained for the possibility that the world might bend backward and return what she had saved to her, older and broken and staring at her with the kind of confusion that suggested he was trying to place her, trying to remember the only hands that had ever held his life together in the dark. His lips moved. Not speaking, he couldn't hear his own voice well enough to modulate it, probably, though the chart didn't specify his communication preferences yet. He was signing instead, his right hand moving in shapes against the bedding of the stretcher. One word, repeated. Once, twice, 3 times, his left shoulder moving in the motion of signing because his left arm was gone now and his body was compensating for the missing part the way bodies do. Reaper. Katie's hands were moving before her mind caught up to what was happening. She was pulling on fresh gloves. She was stepping toward his bed. She was arranging her face into the expression of a competent nurse checking on a new admission, nothing more, nothing unusual, just someone doing her job in the way she had done it 1,000 times before. The other nurses would assume she had been assigned to his care. The doctors would think she was following protocol. Nobody would know that she was standing at the bedside of a ghost, a boy who wasn't a boy anymore, a child she had pulled from rubble 2 decades ago and carried to safety, now grown into a warrior who had lost an arm to the same kind of violence that had nearly taken her spine. She began learning his communication style immediately. The staff wouldn't have time to do it properly, not in the first hours, not when they were still stabilizing him, still running tests, still figuring out the full extent of his injuries. So Katie started teaching herself what she would need to know. Simple signs first: water, pain, nurse. Her hands weren't as fluent as they needed to be, but they would be. She had spent the last 3 years disappearing into Seattle General. She could spend the next week disappearing into this, learning the language of a man whose life she had saved before she even understood what saving meant. Dr. Ashford appeared in the ICU doorway at 7:15 a.m. He watched her for exactly 30 seconds, watched her positioning around the bed, watched her studying the chart with the intensity of someone trying to memorize something no one had asked her to memorize, watched the way she was already beginning the awkward grammar of sign language, fingers spelling out names and dates to a patient who seemed to understand her in a way that suggested something more than professional concern. His expression shifted. Not quite anger. Something colder. Something that looked like recognition of a kind, recognition that Katie Morrison, the invisible nurse who never complained and never advanced, might be capable of independent thought. Might be capable of stepping outside the hierarchy he had so carefully constructed. She felt the weight of his attention like pressure. Like something fundamental had changed in the ecosystem of the ward. She didn't look up from the admission chart, didn't break her concentration, didn't give him anything to hold on to. Her hands continued their halting, patient movements, spelling out words to a patient whose eyes never left hers, whose recognition of her was written across his face in a language everyone could read. Under her scrubs, against her skin where no one could see it, the broken dog tag on its fractured chain grew warm against her collarbone. She pressed her palm against it once, through the fabric, a gesture so small no one could have noticed it, a connection to the man she had married in dress blues at Arlington National Cemetery, a man who had died in the same operation where she had carried a child to safety. The shift continued. Hours passed. The ICU filled with the sounds of machines and careful medicine and the soft movements of nurses doing work that the world would forget by evening. And somewhere in Seattle General, Dr. Richard Ashford went back to his office and made the first of the phone calls that would set everything else in motion, that would transform a quiet nurse into a threat to be neutralized. The medication order was wrong. Katie saw it the moment Dr. Ashford wrote it: 10 milligrams of morphine for a patient with blast trauma and potential intracranial pressure elevation. In combat medicine, you didn't load the CNS like that. You waited. You monitored. You moved carefully with neurologically injured soldiers because one miscalculation and their brain swelled against their skull like a fist clenching inside a box. Marcus Chen lay in the ICU bed, his ventilator hissing its mechanical rhythm, and Katie knew, not suspected, knew, that Ashford had never treated a Bagram casualty in his life. She caught Ashford at the medication cart at 3:51 a.m. The unit was ghost quiet, skeleton crew, fluorescent panels casting everything in that particular shade of institutional white that made blood look black and skin look like wax. "Doctor." "The morphine order." Her voice was deferential, the mask still intact. "Just a concerned nurse. Combat blast injuries present different. Elevated ICP risk. Recommend holding until neurology assessment clears." Ashford didn't look up. His hands were steady as he continued charting, but something in his shoulders tightened. He was a man unaccustomed to being questioned, a private school education evident in the Rolex that cost more than Katie's truck, legacy privilege written in the way he moved through space as though the hospital had been built to accommodate his specific dimensions. "I'm aware of the pathophysiology, Ms. Morrison." His tone suggested she'd recommended treating the patient with crystals and prayer. "The order stands." "The patient's neurological baseline is." "The order stands." He turned then, full body, and the look he gave her was the kind reserved for insects. "Unless you have a medical degree and a license I'm unaware of, I suggest you administer what's ordered and stop improvising at my patients' bedsides." That's when he said it, the line that would echo through the break room, the line that would be repeated in whispers and sympathetic grimaces and averted eyes. The line that revealed what Ashford actually believed about people like her. "You're a floor nurse. Act like one. Stop pretending you're something more than a mop with a stethoscope." The room went dead silent. Nurses at the station 30 feet away froze mid-keystroke. A resident actually looked up. Katie took one measured breath through her nose. One. Then her eyes met his, and Ashford saw something flicker across her face, not anger, not hurt, but something else. Something that made him need to look away first. "Sergeant Chen deserves someone who remembers what combat injuries actually look like," Katie said. Her voice was still water. Completely calm. She wiped one tear without breaking eye contact, then turned and walked back to Marcus's bedside. That should have been enough for her to disappear into. That should have been the moment Ashford felt satisfied. But it wasn't. Because she'd done something worse than accept the humiliation, she'd transcended it. She'd taken his insult and transformed it into something else entirely, and now every person on the unit was thinking about what she'd meant. Wondering. Noticing that her hands had moved with certainty as she adjusted Marcus's ventilator settings. That she'd known exactly which dressing needed changing and in what order. That the way she'd spoken his name carried a weight that suggested they shared something more than just the standard 6 hours of ICU nursing care. By 6:44 a.m., Ashford's formal write-up was posted on the unit board, laminated and official, citing insubordination and overstepping scope of practice. His signature was thick and deliberate, the kind of signature that wanted to be seen. The incident had been recorded with clinical precision, date, time, the specific words she'd used, the medication she'd questioned, her inappropriate assumption of clinical judgment. Attached was a performance improvement plan requiring her attendance at a scope of practice clarification seminar by month's end. Katie read it once, then continued her rounds. Ashford didn't know, couldn't have known, that he'd just started the clock on something he couldn't stop. But he could feel it. The way staff members began moving when she entered a room. The way people suddenly had urgent reasons to be elsewhere. He'd constructed his power carefully over 16 years at Seattle General, built relationships with board members, cultivated alliances with senior physicians, positioned himself as the indispensable surgeon whose competence and vision elevated the entire department. Nurses were replaceable. Nurses followed orders. Nurses didn't question. But Katie didn't flinch from the write-up. Didn't crumble. Didn't retreat to a supply closet or call in sick. She clocked in for her evening shift at 7:06 p.m., and that's when Ashford's real nightmare began. The break room was a cathedral of avoidance. Katie pushed open the door at 7:13 p.m., her shift sandwich and coffee in hand, and the room contracted like a living thing. Two nurses stood by the refrigerator, Jenny from the day shift and Marcus's night shift monitor, and they made immediate eye contact with one another. Jenny grabbed her purse. The monitor checked her phone with sudden urgency. Both of them found reasons to leave. Katie sat at the table. The chair squeaked against the tile. 30 seconds later, Dr. Patel came in for his break, took one look at her, and left without grabbing his lunch. A resident followed. Another nurse, someone Katie had helped train 6 months ago, made it as far as the coffee maker, decided against it, and exited. The silence was so complete you could hear the refrigerator humming its mechanical complaint. This wasn't random. Ashford had made calls. Ashford had mentioned, in that casual way of his, that associating with insubordinate staff members could affect evaluations, could influence recommendations for advancement, could somehow make the career path more complicated for people with ambitions. Ashford had reminded people that he controlled references and recommendations and the annual reviews that determined raises and promotions. Katie drank her coffee. It was cold by the time the cup left her lips. Marcus's parents arrived at 8:22 p.m., and Ashford positioned himself in the patient room like a commander surveying his territory. He was attentive, solicitous, his hands gentle on Marcus's shoulders while he explained the medication protocols and the careful monitoring Katie had supposedly endangered with her interference. Katie watched from the observation window, charting vitals, noting the slight elevation in Marcus's blood pressure, stress response, parental presence, the young soldier understanding that his condition was serious enough to warrant his mother's hand trembling as she held his. She made a decision that would cost her everything. At 10:38 p.m., she approached Ashford in the supply room. He was alone, reaching for sterile gloves, and he turned with the expression of a man who'd been interrupted mid-thought. "The morphine dose is causing respiratory depression," she said. Her voice hadn't changed. Still deferential. Still technically correct. His oxygen saturation dropped to 89% during his last sleep cycle. "I've documented it. Recommend adjustment." Ashford's fingers tensed on the glove box. He was running the calculation, risk versus control. If she was right, and the patient deteriorated, it would be his order that caused it. If he changed it, he'd be confirming that a floor nurse had been correct to question him. Either way, she'd forced him into a corner. "You're done," he said quietly. His voice carried a certainty that made the hospital air feel thinner. "You're finished here. Don't bother coming back tomorrow." Katie didn't respond. She finished her shift, documented every note, checked every line, made sure Marcus's needs were anticipated and met. She stripped off her badge at 6:38 a.m. and walked out through the main entrance where rain was falling so hard it sounded like static on a radio. She drove to Arlington National Cemetery. The gates opened for her like a mercy. Row after row of white headstones, all identical, all equal, all belonging to people who'd given something the rest of the world would never quite understand. She found the one she'd been visiting once a month for 14 years, Lieutenant Commander James Morrison, United States Navy, killed in action, Helmand Province, August 2009. Katie knelt in the wet grass. Rain soaked through her jeans, cold and real and punishing. "I tried to save just one more, Jamie," she whispered. Her hands were shaking, not from fear, from restraint. From the weight of all the things she'd swallowed. "I tried to stay invisible and just save one more, but I failed again." The rain fell harder. Lightning fractured the grey sky. And in the darkness of that cemetery, Katie Morrison wept for the first time since she'd buried the uniform that had cost her everything. She had no idea that the clock had already started counting down somewhere else. That a young man in an ICU bed, struggling for breath under the wrong medication order, had just whispered her call sign to a nurse practitioner who'd spent for years in the 75th Ranger Regiment. That a single phone call was about to reach JSOC headquarters. That the Pentagon itself was now aware that Major Catherine Morrison, the woman Ashford had just fired as an insubordinate mop, was real. The monitors exploded first. 3 alarms at once, a cascading symphony of beeps that meant the world had just tilted sideways. Katie was charting at the unit desk when the ceiling light seemed to pulse with urgency, that particular frequency that every ICU nurse learns to read in her sleep. Marcus's bed. Row 4. The one she'd been checking every 47 minutes whether the schedule required it or not. She moved before thinking. The legs got her there faster than thoughts could follow. Marcus lay rigid, his chest heaving in a way that said something inside him had catastrophically failed. His oxygen saturation was already dropping, 89, 87, 85. The monitor's rhythm was climbing, heart rate 148, then 156. His breathing sounded wrong. Not wheezy. Not obstructed. Absent. Like his lungs had simply forgotten their job and his body was screaming at the betrayal. The code team wouldn't come. Katie knew this before she called it. She'd watched Ashford work for 3 years. She understood how he redistributed staff the way a chess grandmaster positioned pawns. The experienced nurses, Rivera with 22 years in critical care, Jackson who'd seen everything, Hernandez with hand steady as a laser, had all been reassigned to other units in the last 36 hours. After her firing. After her very public, very humiliating exit from Ashford's domain. The night shift roster was skeletal. Inadequate. Deliberately so. And there was a multi-vehicle collision on Interstate 64 tonight, 6 patients coming in hot, which meant the trauma team was fully activated, fully distracted, and fully unable to respond to anything that wasn't arterial bleeding. She was alone. The ventilator wheezed its mechanical rhythm, but Marcus's chest wasn't rising. Not anymore. She placed her palm against his sternum and felt nothing. No rise, no fall, just the frantic flutter of a heart losing its argument with physics. Tension pneumothorax. The blast injury from Bagram had left scar tissue, adhesions, structural weakness. Something had given way. Air was filling his chest cavity, collapsing his lung, pressing against his heart, strangling him from the inside. She reached for the crash cart. Her hands moved before her mind caught up, muscle memory from another life, from a compound in Loga province where a 14-year-old boy had caught shrapnel and stopped breathing. From a dozen other moments she never talked about. The scalpel felt familiar. Terrifyingly familiar. She'd sworn she was done with this. She'd rebuilt herself into someone who changed wound dressings and documented vital signs and kept her head down. Someone invisible. That person was gone. Marcus. Listen. I need you to trust me. Her voice had dropped an octave. The woman speaking didn't ask permission. She didn't apologize. Second intercostal space, mid-clavicular line. You know this. You've trained for this. Stay with me. She prepped the site with antiseptic. The smell of it, sharp, chemical, 1,000 memories compressed into a single inhalation. The scalpel went in at a 90-degree angle. Muscle memory took over. She'd done this on soldiers bleeding out in vehicles, on civilians caught in airstrikes, on the 8-year-old boy they pulled from the rubble in Bagram district, the one whose name was Marcus Chen and whose eyes had been wide with terror until she touched his chest and spoke to him in a language his body understood better than words. The hiss of air escaping. That's what told her she'd found it. That singular sound of pressure releasing, like a tire valve when you finally give it permission to deflate. That's it. Breathing now. His chest rose. Fell. Rose again. She kept her left hand positioned over the decompression site while her right hand found his wrist. Carotid pulse present. Good. The monitor reflected the change, heart rate dropping from the terrified 162 down toward something almost human. 148, 142. 138, his oxygen saturation began the climb, 68. 71, 75. Her own breathing steadied to match his. In through the nose. Out through the mouth. Pain was information. Pain was data. Right now his body was telling her he was alive because she'd listened. The code team didn't arrive for another 83 seconds. When they did, when Dr. Reeves burst through the doors with a physician assistant and two nurses Katie had never seen because they worked the trauma side, they stopped. They stared at Katie standing there with blood to her elbows, with her hand still positioned at Marcus's chest, with a confidence in her posture that belonged to someone who'd done this before. Someone who'd done this many times. Needle decompression, Katie said. Her voice was steady. Clinical. Tension pneumothorax. He needed it immediately. Trauma's got 6 incoming from I-64, so I stabilized. Dr. Reeves was 58, competent, and smart enough to recognize command authority when it dressed itself in scrubs. Good call. You need to step back. Katie stepped back. She'd already done what needed doing. The rest was their choreography now. But Dr. Reeves caught her wrist as she turned. His eyes dropped to her hands, to the scarring that ran in parallel lines across her knuckles and the meat of her palm. Blast scars. Surgical scars. Trauma that had been survived and survived and survived until the body got tired of showing the evidence. Combat medicine, he asked. Not a question. A confirmation. Long time ago. She didn't elaborate. The code team was working, and Marcus's oxygen was climbing now, 82, 85, 88, 92. Stable. He was stable because she'd moved and her hands had remembered and her training had overridden the exhaustion of being invisible for so long. The nurse with the dark hair, the young one with the medic's haircut, was staring at Katie's hands too. She had that look. The look of someone who'd seen things. Done things. Survived things that didn't come with discharge papers and gratitude letters. For Benning, the dark-haired nurse asked quietly. Katie didn't answer. She was already moving toward the sink to wash off Marcus's blood. Already thinking about what would come next. Because Ashford would see the monitor's log. He would see that Marcus had coded. He would see that Katie had been the one to respond, to stabilize, to do something that was beyond her station and outside her authority and so far outside the rigid structure he built that the entire architecture would start to crumble. He would fire her again. But not before something else happened first. Not before a phone started ringing in an office at the Pentagon where someone was reading a classified file about a rescue mission that happened 20 years ago in Bagram District, about a special forces medic with a call sign that sounded like a ghost, about a woman who'd been erased from records and rebuilt as a hospital nurse and was about to become visible again whether she wanted it or not. The clock on the wall showed 22:38. Somewhere above the city, a helicopter was already being fueled. The monitor flatlined at 22:38. Marcus's heart had stopped. The ventilator wheezed its mechanical rhythm, indifferent to the fact that the man it was trying to keep alive was already gone. Katie moved. Not toward the crash cart. Not toward the phone to call a code. She moved toward the instrument tray with the precision of someone who had performed this exact procedure in a desert compound with nothing but a combat knife and a prayer. The scalpel was in her hand before her brain caught up to what her body already knew. Fourth intercostal space. Left side. Just below the nipple line. Pain is data. Data is survival. The blade went in. Blood spilled across her gloved fingers, dark and urgent. She didn't flinch. The skin opened like it remembered her hands. Muscle memory isn't memory at all, it's cells screaming what they've done before, what they're desperate to do again. Her fingers found the ribs, separated them with the kind of care a pianist uses on ivory keys, and cracked Marcus's chest open with her bare hands. The rotor wash sound was still distant, but her hands were already here. Already moving. She worked around the shrapnel pattern she'd memorized in another life. Bagram had given her an education no medical school could replicate. Blast injuries leave signatures. The way soft tissue fragments tells a story. The pattern of how organs shred when a pressure wave exceeds the human body's capacity to absorb it. She'd studied these signatures on living men. She'd learned the architecture of trauma from the inside. Her right hand found his pericardium. Opened it. The blood drained away, black and still warm, and there was the reason. The tension had compressed his heart until it couldn't beat anymore. A single needle decompression earlier hadn't been enough. The pneumothorax had evolved. Was evolving still. Katie's left hand was already on his chest. Manual cardiac massage. 60 compressions per minute. No. Faster. 80. Her palm against his ribs, fingers curved around his beating, no, not beating, her pushing, his heart. Squeeze. Release. Squeeze. Blood moving. Oxygen flowing. Life happening because she refused to let it stop. Come on, Marcus. Her voice was steady as a surgeon's scalpel. I didn't pull you out of a building for you to quit on me now. The code team arrived for minutes later. Which felt like 4 seconds. Which felt like for years. They stared. A nurse, the quiet one, the one nobody noticed, the one who made the coffee run and didn't talk much, was standing over an open chest cavity with her forearms painted in blood up to the elbows, manually massaging the heart of a patient who should have been dead 3 minutes ago. Her compressions were perfect. Synchronized with the respiratory therapist's ventilations. The monitor showed sinus rhythm. Actual, real, beautiful sinus rhythm. One of the surgical residents, a third-year named Chen with trembling hands, said, "How is he? What did you?" "Bilateral tension pneumothorax," Katie said. Her voice had changed. Just slightly. Like someone who'd been giving orders for 2 decades. Missed on the second ultrasound. He needed bilateral decompression, not unilateral. Get a chest tube in. Left side first. 14 gauge minimum. I'll stay on compressions until you're done. She didn't ask. She commanded. Nobody moved to argue. Her hands were keeping a man alive. Her hands knew things their hands didn't. The attending, Dr. Morrison, wasn't running this code, she was running it, moved with the certainty of someone who'd saved people in places where there were no hospitals, no backup, no second chances. The room shifted. The power in that room shifted. Ashford arrived for minutes after that, stepping into the ICU with his phone already to his ear, his voice already loud, his superiority already assembled like a suit of armor. He took in the scene. Marcus stabilized, Katie soaked in blood from her shoulders to her hands, the monitors showing vitals that moments ago had been flatlined. His face went through 5 emotions in as many seconds. Shock. Calculation. Rage. Then something colder. Something strategic. He didn't say a word to Katie. Didn't ask what she'd done or how she'd done it. Instead, he turned to security and said, "This nurse is not to touch another patient. Not authorized surgical procedure. Immediate suspension pending termination." It wasn't a request. It was a command. Katie looked at him for exactly 2 seconds. 1 measured breath. Her hands were still wet with Marcus's blood. She reached for a towel and cleaned them with the methodical precision of someone stripping a rifle, no hesitation, no emotion, just the work of making something clean again. "All right," she said. Her voice was very quiet. She didn't argue. Didn't explain. Didn't break eye contact with Ashford as she peeled off her gloves and set them in the biohazard container like she was laying down armor. The dog tag underneath her scrubs caught the light, a brief glint of metal that no one in the room understood meant anything at all. By 6:17 a.m., Ashford had moved faster than he'd ever moved before. 3 phone calls to board members. 1 formal termination letter citing unauthorized surgical procedure by non-physician staff, violation of scope of practice, and patient endangerment through unlicensed intervention. Security escorted her from the building at 6:22 a.m. with a cardboard box holding 8 years of personal items, a photo of a man in a Navy uniform, a half-empty bottle of ibuprofen, 7 pairs of compression socks, and the single dog tag on the broken chain that she kept hidden under her scrubs. The box felt heavier than anything she'd ever carried. She drove in silence. The rain started somewhere around Route 460, light at first, then the kind of rain that doesn't ask permission. that doesn't care if you want it to stay dry. Her hands were still steady on the wheel. Her eyes were still forward. She didn't let herself fall apart at the traffic light on Military Highway. Didn't let herself fall apart at the Walmart parking lot. Didn't let herself fall apart. Arlington came into view at 8:33 a.m. with the rain coming down in sheets. The cemetery grass was slick and dark. Her shoes left prints that the rain immediately tried to erase. Tried and failed. She found the stone without checking the map in her phone. Section 60. Row D. The name carved into granite like a prayer carved into stone, Lieutenant Commander James Morrison. Kia. 2004, Bagram. The same operation. The same day she'd taken a piece of shrapnel through her spine. The same moment their lives had ended, his completely, hers in pieces. Katie knelt. The rain soaked through her jeans instantly. She didn't move. Didn't seek shelter. The cemetery was empty at this hour. The sky was the color of old concrete. She pulled the dog tag from under her collar, the one that didn't have her name on it, the one that had been in James's pocket when they pulled him from the ruins, and she pressed it against her forehead. I tried to save just one more, Jamie. Her voice broke. Not publicly. Not in front of anyone who mattered. Just here, at a stone carved with the name of a man who'd never come home. I tried to stay invisible and just save one more, but I failed again. The rain hammered down like accusations. She'd blown the cover that took 8 years to build. She'd revealed her hands to people who would testify against her. She'd disobeyed orders from a man who controlled her career, her license, her future. She'd done exactly what she'd promised herself she'd never do again. She'd stepped out of the shadows, and the shadows had swallowed her whole. "I'm sorry," she whispered. "I'm sorry I came home and you didn't. I'm sorry I'm still here. I'm sorry I couldn't save you like I saved him." The rain didn't answer. The stone didn't answer. The cemetery air was still and heavy with the weight of all the people buried beneath it, all the wars that had come home in boxes, all the sacrifice that nobody kept count of anymore. She stayed there until her hands stopped shaking. Until her breath came back. Until she could lift her head without falling apart. And that's when she heard it. First, just a vibration. Then a sound. Then unmistakable. The rhythmic percussion of helicopter rotors cutting through rain-thick air, far enough away to not be real, close enough to be real. Getting closer. She lifted her head. One hand shielded her eyes against the downpour. The helicopter wasn't approaching the cemetery. Wasn't part of the cemetery. But it was coming toward Norfolk. And Katie Morrison, still kneeling at her husband's grave, still soaked in rain and grief, still holding a dog tag that didn't have her name, felt something crack open in her chest. Something that had been sealed shut for 8 years. Something that had been waiting. She had no idea what was about to happen next. 24 hours after the hospital had kicked her to the curb, Marcus Chen opened his eyes in the intensive care unit. His chest rose and fell in sync with the ventilator's wheeze. The machines around him beat their steady rhythm, heart monitor, O2 sat monitor, arterial line pressure, all showing numbers that belonged to a man who should have died on that surgical table. A nurse practitioner stood checking his vitals, recording numbers on the electronic chart. Marcus's eyes moved. Focused. Aware. He lifted his right hand slowly, palm up, fingers curling in that specific pattern. One hand shape. One motion. Unmistakable. The nurse practitioner watched him sign the single word, Reaper. Her hands went still. The stylus dropped. She was former Army medic, 82nd Airborne, 2006 to 2010, and she had heard that call sign exactly once in her life, in a classified briefing about a medevac specialist whose saves numbered in the hundreds. She pulled Marcus's intake file with trembling hands. There. In the original notes from his admission. The narrative history written by the ER physician. Patient reports childhood memory of rescue during Operation Enduring Freedom, Bagram region, approximately 2004. Rescued by Special Forces Medical Officer, call sign Reaper. Sustained severe burns and crush injuries. Officer performed field treatment with minimal equipment and extracted patient under fire. Patient credits this officer with his life. The words blurred. The nurse practitioner's vision tunneled. She stepped into the supply closet, closed the door, and made one phone call. She dialed a number she had memorized 8 years ago and never forgotten. JSOC Task Force Operations Line. 2 rings. She gave her old unit code and the name, Catherine Morrison, call sign Reaper, Special Forces Medical Officer, Major rank. Last known location, Seattle General Hospital, Norfolk. Current status, terminated by hospital administration approximately 20 hours prior. The voice on the other end said nothing for 3 seconds. Then, confirm. Is the patient alive? Yes. Stand by. The line went dead. 37 minutes later, in a television studio 200 miles south, Dr. Ashford stood at a podium with prepared remarks. The cameras were rolling. 5 local news affiliates. The hospital's communications director had scripted everything. He was going to be the hero of this narrative. Professional standards. Patient safety. The necessity of maintaining the rigid hierarchy that kept medicine from descending into chaos where any nurse with a scalpel could play surgeon. He cleared his throat. He had been practicing this speech for 18 hours. This hospital maintains the highest standards of professional conduct. When a staff member violates scope of practice, when a nurse performs surgical procedures reserved for physicians, we have no choice but to enforce institutional discipline. What happened yesterday was a dangerous breach of protocol that could have resulted in criminal liability for this institution. The individual in question has been terminated, and we are confident that the call screener's voice cut through his earpiece. Doctor, we have a live call from Admiral James Kirkland, Commander of Naval Special Warfare. He's requesting to speak. Ashford's face froze. The communications director's face froze. The camera operators kept rolling. 3 seconds of dead air on live television. Then Ashford nodded to the call screener. The audio system connected. The voice that came through was granite. Authoritative. The voice of a man who had commanded 12,000 warriors across 7 countries. Dr. Ashford. Before you continue, I want to speak for the record, and I want this broadcast to reach every person watching. You just terminated Major Catherine Morrison from your nursing staff. She is the recipient of 2 silver stars. Ashford's mouth opened. Nothing came out. The Admiral continued. She is the recipient of a Defense Meritorious Service Medal. She is the recipient of the Purple Heart. The Admiral's voice did not raise. It did not need to. And the man whose life she saved yesterday, Sergeant Marcus Chen, is the same individual she rescued as an 8-year-old child during Operation Enduring Freedom, Bagram Province, in 2004. She pulled him from a collapsed building under fire with nothing but field supplies and the kind of moral courage that your institution clearly does not recognize. The broadcast cut to a split screen. Admiral Kirkland, in uniform, at JSOC headquarters in North Carolina. Ashford, pale, at the podium in Norfolk. Major Morrison performed over 200 combat medical saves during classified operations in Afghanistan. She is a decorated combat veteran. You fired her for doing exactly what she was trained to do, saving a life when conventional protocol was inadequate. The Admiral ended the call. The silence lasted exactly 4 seconds. Then the hospital's communications director stood. She was walking toward Ashford, shaking her head. The camera operators were still recording. The broadcast was still live. Somewhere between the studio and the parking lot, Ashford's career was burning. By the time the press conference ended, 3 members of the hospital board had called emergency legal counsel. By the time Ashford stepped off the stage, his phone was ringing with the board's chairman. By the time security escorted him to his office, he had been terminated. His medical license was suspended pending a federal investigation into patient endangerment through deliberate understaffing. the hospital issued a public statement of apology within the hour. It took them 42 minutes. 6 months later, Katie walked through the doors of the VA hospital's new trauma wing. The Pentagon had funded the expansion within weeks of the broadcast. Veteran-focused care. Combat injury specialists. A place where warriors could heal without judgment. She was chief of trauma now, though she had asked to keep her nursing position, to stay in scrubs, to keep her hands doing the work instead of sitting in an office. The night security desk was in the main corridor. She saw him before he saw her. Richard Ashford. That was his real name. Just Richard now. No DR. No title. No authority. He wore a grey uniform that hung wrong on his frame. He had lost weight. His hair had greyed at the temples. He looked at the floor. He always looked at the floor when nurses passed. They did not speak to him. He did not speak to them. When Katie walked past, carrying the dog tag she no longer needed to hide, when she walked past with her head high and her shoulders back, Ashford's eyes flickered up for exactly 1 second. Then he looked back down. He had no idea that she was not looking at him with anger. She was looking at him with something worse, recognition. She knew exactly what he had lost because she had watched him choose to lose it, one strategic decision at a time, until there was nothing left but a night security guard afraid to make eye contact with the woman he had tried to destroy. 3 hours later, in a classroom on the 3rd floor, Katie taught an ASL class. 23 medical staff sat in a semicircle. Trauma surgeons. Respiratory therapists. Nurses. Pharmacists. All learning American Sign Language so they could communicate with deaf and hard-of-hearing patients without fumbling or frustration. Marcus sat beside her. He was a volunteer patient educator now, helping staff understand what deaf warriors needed from their medical teams. He was missing 3 fingers on his left hand from the blast that had nearly killed him, but his hand still signed with precision. With poetry. Katie demonstrated the signs for shock, for hemorrhage, for emergency procedures. The room was completely silent except for the soft rustling of bodies shifting in chairs. Focused. Present. The broken chain around her neck was repaired now. The dog tag hung openly. The room had seen the broadcast. Everyone had seen the broadcast. She did not need to hide anymore. And in the absolute quiet of that classroom, with Marcus signing beside her, with 23 people learning how to see patients as whole human beings instead of diagnoses, Katie understood something that had taken her 20 years to learn: the bravest warriors do not carry guns. They carry stethoscopes. They carry ASL flashcards. They carry the absolute certainty that every life matters, even when institutions tell them it does not. Even when the world tries to erase them. Even when they have to rebuild themselves from scar tissue and memory. The trembling was not fear. The trembling was restraint. Restraint from walking downstairs and speaking to the man she had forgiven, because forgiveness was not something he deserved. It was something she deserved to give herself. Scars tell stories. And Katie Morrison's scars told the story of a woman who had chosen, over and over again, to save the people in front of her instead of waiting for the world to notice. And now the world was watching. Now the world was learning. Now the Pentagon was building hospitals. Healing takes time. But sometimes, if you are patient enough, if you are brave enough, the world catches up. If you were Katie Morrison, standing at that podium with a military officer overriding the hospital's authority, would you have stepped back in to save that patient? Or would you have walked away and let them suffer the consequences of firing you? Subscribe, like, and comment with your answer. Let's talk about what true authority means.